Okay, firstly, I should just tell you what you'll find in this part of the package. There are JPEG copies of 6 sheets from the records for the parish of St Mary's, Bryn Mawr, which is today in Blaenau Gwent, but was formerly in Breconshire. The town was entirely a creation of the Industrial Revolution, a dormitory settlement serving workers from the surrounding collieries and ironworks, and is, I believe, the highest town in Wales at just over 1,300 feet above sea level. The records cover the period November 1891 to December 1894 and are complete but for one missing sheet of 8 entries covering August to December 1893. They therefore represent a pretty much complete sample. As usual, I've supplied background notes for the records, which not only provide essential historical information, but also some statistical analysis, together with suggestions for useful teaching or talking points. In the appendix, you'll find the original sheets transcribed into modern script for those learners who find the originals difficult to read. I'll make some comments later on in the film about translating old-fashioned text into modern idiom, so I'll say no more at this point, but I will refer to it later. I've also put the entries from the sheets onto a spreadsheet, both so that we can study and analyse the sample as a whole and produce some graphs and charts from it. This is in PDF format, but I've also included an Excel version of the spreadsheet file too. Now, I should just offer a product warning here. I don't use any Windows or Microsoft applications and haven't done so for years. So whilst I can export Apple Mac documents into Word or Excel, I know that some features are lost in translation, but I can't really test them to find out which they are. Export to PDF is 100% pure, but not so to Microsoft. Having said that, this is a really simple spreadsheet, so hopefully my version may save you some time in creating your own. So what can we do with the records? In the inquiry plan, I suggest a simple sequence. 1. The teacher introduces burial records to the whole class, using one record sheet to interrogate, say via the whiteboard. 2. Learners work in pairs or groups on the remaining record sheets, perhaps using just one per group. 3. The groups feed back to the whole class and share their findings. 4. The teacher introduces the full spreadsheet sample and sets learners some data handling tasks to help make sense of the figures, the crucial issue here being the age at death. 5. The teacher leads discussion regarding the evidence revealed by the graph and chart making. They also examine some further talking points from the sample, such as possible causes of death, multiple deaths from the same family, etc., and asks learners to consider what we can and cannot learn from this type of record, i.e., what is fact, such as age or name, and what we might infer, such as causes of death. Now, let's go through that and add a few comments. Starting with step 1, the initial introduction. You can use the typed versions of the sheet if you wish, but I think you must start by showing learners a picture of an original. Just as an actual gravestone has more character and power than a plain piece of paper with the same information written on it, so an authentic record, albeit a copy, is more atmospheric and engaging than a modern clinical transcription. The latter might be more practical, but apart from anything else, learners need to see for themselves that people didn't have computers or printers in the 19th century, or they will assume that they did. Moreover, a handwritten record, with added notes and scribblings, adds a more human and personal flavour to the inquiry. Use modern versions by all means, but do at least show learners what the actual records look like. Step 3, the feedback from learners' groups after studying individual record sheets. The optional extra, which I didn't mention in my summary above, is for learner groups to add their own data to an evolving class spreadsheet. This is merely a suggestion. It's up to teachers to decide whether this is either practical or useful for them. Step 4, the data handling tasks. Again, I'm leaving it up to teachers to decide exactly how this should be carried out. Should the graphs or charts be created from a spreadsheet or drawn out by hand? Should the age of each individual be plotted, or is it enough to place people into age categories, like under 2 years old, 2 to 10, etc.? Is a line graph more effective than a bar chart or a pie chart? Some of these decisions can be made by learners themselves, and this is all part of their learning about how to process and analyse information. Other choices, like computer or hand-generated graphs, are for the teacher. From the point of view of the inquiry, the critical issue is the age at death, and we simply need a more visual way of seeing these numbers expressed. Not least because we want learners to understand who was most at risk. Once we know that, we can start to ask why. So you must decide how much time and effort you devote to the graphing exercise. This is a good example of the need for numeracy skills in a genuine curriculum context, and an opportunity of practicing and developing them with a real purpose. Just don't get bogged down in graphing for the sake of it, or learners will lose the momentum of their inquiry and therefore lose the train of their thinking. Step 5. The wider discussion of the spreadsheet evidence. Once again, I've left choices for you, as you could set specific tasks or questions for learners to allow them to interrogate the records more independently, or you could carry on with the whole class in posing questions and issues for discussion. I might have my own preference, but that wouldn't be based on any knowledge of your learners, their abilities or interests. So it's better for you to make the choice, bearing in mind that not all learners need to carry out the same activities. Finally, the last step, an assessment or communication task which may or may not be carried out here. Personally, if I were going to go on to the third stage of the inquiry, which actually is the part that learners will enjoy the most, I wouldn't make much of a recording task here. I'd save it to the end. You could perhaps get learners to annotate a graph or chart with comments and analysis, or perhaps do something similar with a record sheet or extract from the spreadsheet. Something along these lines would be enough at this point. Now, for some teachers, this may be as far as they wish to go. In investigating the impact of poor housing on health, we've discovered that premature deaths of infants and children were commonplace in 19th century industrial Wales. In fact, children under 10 were the age grouping most at risk, according to our sample of parish burial records. Why? Well, we can reasonably deduce that it wasn't working life that was killing them, as even by 19th century standards, most of our victims were far too young for work. Mostly, they were too young for school either. So it must have been something about their home environments that was so detrimental to their chances of surviving childhood. But exactly what? Malnutrition? Lack of hygiene? Disease? We can't say exactly as yet, but it's probably a fair assumption that the overcrowded, badly maintained homes had something to do with it. For those who want more definite evidence, we can move on to our third and final source, mid-19th century medical reports. Now I have to say this is where it starts to get juicy, gory and positively sick-making. The evidence for filth, pollution and squalor and their effects on people's health fair makes your hair stand on end, but that's why it's powerful and engaging. And these extracts are not from some fantasy tale or Hollywood movie. These are from formal, factual reports to serious authorities. There may be inaccuracies due to the relative medical ignorance of the time, but the content is essentially trustworthy. Now, we have a time lag of 40 years between our burial records and these medical reports, but such is the nature of inquiring into the past. We rarely have all the evidence we ideally need or want for a given point and place in time, so we have to mix and match a little, and learners need to understand that. Bryn Mawr and Newport were part of the same industrial system, as the products from the ironworks and collieries at the top end of the valleys were fed down to the great seaports along the coast, like Newport or Cardiff and Swansea. All towns in this system grew at a colossal rate during the 19th century, but this rapid expansion was definitely at the expense of quality building of houses, streets or basic infrastructure like drainage, sewerage and water supply. And don't take my word for this, read the extracts. I don't have to say a great deal about the content because it rather speaks for itself. When we can see evidence of drinking water poisoned by liquids seeping from rotting corpses, stagnant pools of toilet waste reeking and fuming in the streets, overcrowded rooms heaped up with rotting vegetables and fish, open sewers from the fever hospital running past people's homes, this can't fail to grab youngsters' attention. But one issue which does arise out of using texts from this period with young learners is the accessibility of the language, which is obviously archaic and somewhat verbose. In the extracts, I've included notes for learners on tricky words and phrases, and teachers can always offer their own support. But I've taken a further step with both reports by offering translations, for want of a better word, of the more tricky extracts into modern language and idiom. Essentially, I've tried to both preserve as much of the original text as possible and retain the structure and sequence of each piece. Teachers can decide for themselves which versions they give to learners, or try their own hands at modernising the text. But remember, you mustn't jumble up original and modern versions without making it clear which they are. In the notes, I've arranged the two versions side by side, and if you are going to use modern text, this is how I think you should present it to learners, so that they can see where the modern text has come from. I should just mention a couple of supporting documents I've included in this section. Firstly, the Clark Report Learner Recording Sheets. Different teachers will use the extracts in different ways. But if you do want learners to read through several extracts and pick out key information or ideas, I think it's helpful for them to have some kind of recording sheet to give them prompts as to what this key information might be. It's always easier to find clues when you've some idea of what you might be looking for. To be honest, I'm not completely happy with the recording sheet as it stands, but I've offered a couple of examples of what it could look like when completed. Obviously, some sections won't apply to some extracts, so learners shouldn't feel under pressure to fill the whole sheet in unless the evidence is there. Using the recording sheet shouldn't be an assessment task as such. It's merely a way of helping learners to find and record information they might need later in their discussions or communication tasks. Secondly, we have the homes or death traps picture. Now, this has no original link with either the Clark or the Woolwich reports, but it shows the type of street that both men were commenting on. My thinking behind including this picture is simply that it's easier to absorb information about a situation if you can actually picture it in your mind's eye. Remember what we talked about in part 1 of the inquiry. As adults, we have memory banks with images of scenes from the past because, for example, of the television we've seen. I was watching Ripper Street last night, and the recreations of East End London streets were absolutely gross, but highly atmospheric and memorable. And those are pictures I can now call to mind any time I might read about Victorian streets. But youngsters may not have these personal resources yet, so any help is useful. I've suggested in the inquiry plan that teachers might add the quotes from the report by Dr. Woolwich to those from the Clark report, because the conclusions we can draw from both are essentially the same. We asked the question, why were so many young children dying? And the extracts from the report make the answer pretty clear. It was the squalor of their home conditions which bred the diseases that killed them. But specifically, what diseases? I've highlighted the table in the Woolwich report which lists the supposed causes of death of the 177 people who'd passed away in the preceding 3 months. This reveals almost as much about the weaknesses of medical care in those days as it does about the actual causes of death. Once again, it's for teachers to judge whether they pursue this line of inquiry or not. But personally, I think there are at least a few questions worth asking learners to consider. Who decided what the alleged cause of death was, for instance? There was no National Health Service in those days, and consultations with a doctor were normally something that the vast majority of people simply couldn't afford to contemplate. So victims would be cared for by relatives, whose ability to tell one disease from another might be severely limited. And how is it that medical conditions which are nasty today, but in no way life-threatening, could be killers in Victorian times. Which of us hasn't had diarrhoea, for instance? Very unpleasant, but did any of us actually die? There are several possible reasons, which some learners might be able to suggest with a little prompting. Maybe people, and especially infants, were generally less able to fight diseases off, perhaps because of poor diet or lack of hygiene. Remember, in the Woollett report, it says clearly that those living in a clean, healthy environment have a far better chance of surviving illness than those whose bodies are weakened by the poor conditions in which they live. Perhaps our modern drugs and medicines are better and more freely available, i.e. through the NHS. Maybe these so-called causes were in fact only symptoms of a more serious affliction, not the illness itself. So diarrhoea could be a prominent symptom of several fatal diseases like dysentery or typhoid fever, which were not recognised by the caring relatives. If the causes of death listed in the Woollett report weren't completely accurate, what does modern science and hindsight tell us about illnesses which were prevalent in those times and their causes? If teachers want to go this extra mile, I've offered a table of common, serious 19th century diseases which learners can research from. Plus, there are notes with a series of ideas for questions and discussion points to help learners to interrogate the table. So, to the final analysis. Were 19th century houses homes or death traps? Well, in truth, they were both. Most people had little choice where they lived, as they had to move to find work, and their house was tied to their job. Lose your job, you lose your home. Despite the poverty of many of their houses, people doubtless worked exceptionally hard to make them as clean, comfortable and homely as possible. But basic provision for clean water, waste disposal and drainage was often abysmal. Many houses were badly ventilated and permanently stuffy or damp. This often induced chronic respiratory problems for young and old alike, such as tuberculosis, bronchitis or pneumonia. Bacteria and viruses causing typhoid, dysentery, smallpox, cholera, etc. simply thrived in the open sewers, stagnant effluent pools and poisoned water supply. As the 19th century moved on, advances in medicine and public health brought some improvements, but young children remained sorely at risk. In some ways, the wonder is not that so many died, but that any survived at all.